Hello everyone, welcome back to Unified OSCE. In this video, we're looking at administration of inhaled medication, AIM, A-I-M, which is one of the skills you might encounter in your OSCE exam. The allotted time for the skill is 12 minutes. Even though it is a skill, but the protocol for implementation still apply for this because we are administering a form of medication through the inhalation route. The allotted time for the skill is 12 minutes. What materials do I need for the skill? I need my apron, a pair of gloves, spacer device, and a pressurized meter dose inhaler. How do I go about the procedure? As I approach the room, I can confirm the room is safe to approach. There is nothing that can constitute harm to myself or to my patient. And I'm actually checking to be sure there's no risk or harm. And if there is any noted or discovered, I have to take care of it. I ensure privacy is provided by pulling the curtain. I go ahead to do my hand hygiene according to WHO standard. I apply an handful of gel and I rub palm to palm, palm over back of hand, vice versa, palm to palm with fingers interlaced, fingers interlocked, vice versa, thumbs in rotational manner, my fingertips on palm in rotational manner, vice versa, rotational rubbing of the wrist, rotational rubbing of the wrist. And I won't bring my hand back in this way. I put my hands apart and allow my hands to dry for 30 seconds as I approach my patient. Hello.
Hi, nurse.
My name is Ademola. I'm your attending nurse for today. I'm here to give your due inhaled medication at 10th hour. Is it a good time to do that, please?
Yes, nurse.
Oh, thank you so much. But before I go ahead, I would like to confirm your full name and date of birth with your home address as I confirm with the documents I have with me. Is that okay with you?
All right. My name is Harry Johnson.
Okay, I'm checking my documents, Harry Johnson. Yeah, can you tell me your home address, please?
2 Long Street, Northampton, NN27AL.
Perfect, that's what I've got here. 2 Long Street, Northampton, NN27AL. Can you tell me your date of birth?
All right. 1st of January, 1960.
Wonderful. 01/01/1960. Thank you, Harry. Is it okay to call you Harry?
Yeah, Harry's fine.
Oh, thanks. Have you got any allergy you know of?
Yeah, I'm allergic to latex.
Oh, so sorry to hear that. And what happens to you when you have encounter with latex?
Start to get rashes all over my body.
Oh, I want to assure you, Harry, throughout the course of your treatment, we're going to use latex-free materials for you. Is that fine?
Oh, yes, thank you.
And it is well documented that you are allergic to latex. Oh, Harry, are you in any form of pain or discomfort?
Yeah, a little bit.
Yeah. Are you in pain?
Yeah, my back hurts a bit, nurse.
Oh, sorry to hear that, Harry. On a scale of 0 to 10, where 0 means no pain at all, and 10 means the worst pain you've ever experienced, can you rate your pain for me, Harry?
I'd say a 4.
Oh, sorry to hear that. Is it okay just to try to reposition you and support you with a pillow?
Yes, nurse.
Would that be helpful?
Yes, nurse.
Yeah, can you inhale deeply? Take a deep breath. Oh, how do you feel now, Harry?
Yeah, a lot better.
Oh, great. Are you still happy for me to go ahead?
Yes, nurse.
Okay, thank you. And I'm still going to have a look at your document. If you are due for any medication for pain, I'll be back to give that. Is that all right with you, Harry?
That's fine, nurse.
Okay, thank you so much, Harry. So, Harry, like I said, I'm here to give you a due inhaled medication. Is it okay to just read the charts with you?
Yes, nurse.
Okay, wonderful. I have with me the chart of Harry Johnson, address 2 Long Street, Northampton, NN27AL, date of birth 01/01/1960. There is documented allergy latex with rash. The drug name is salbutamol. Dose root frequency, the dose is 200 microgram, which is equivalent to 2 puffs via a spacer device. Signature of the nurse, date and time of administration is stated with the signature, date and time. Prescriber name and GMC number is present. It's prescribed by Dr. Chris Adams, GMC number 456, and it is prescribed today. Harry, the indication salbutamol is a bronchodilator. Just like the name sounds, it helps to dilate your lungs, helps the drug to reach your airway, and that helps you to breathe with ease. Some of the side effects which you might encounter and you might not experience, you might have headache, your heart might tend to beat a little bit faster, dry mouth. These are some of the side effects. And are you still happy for me to go ahead, Harry?
Yes, nurse.
Okay, wonderful. Thank you. So, I have the materials already with me. But in case I have to leave Harry to get my materials, I'm sure Harry can give me a shout, because this is a community setting, just like an outpatient anyway. Harry can give me a shout. But if it is an inpatient setting, hospital setting, I can ask Harry to make use of the call bell. This is a safety access, just to ensure when Harry needs help, he can always get help. But everything I need with me is with me. I'm not leaving Harry's side. Harry, in a moment, I'll just do a get ready for your inhaled medication. Is that all right?
Yes, nurse.
Okay, I put an ampoule of gel again, palm to palm. I do it fast. I don't have to recite it this time, but I make sure no step is missed. I put my apron. I'm going to put my glove. It's a clean procedure, so I'm using a clean gloves. So I will be, of course, part of the things we also have to check. I have to confirm this is the right medication. It's salbutamol inhaler. So I'm sure I've gotten the right drug, the right dose, the right routes, and it's to be given at the 10th hour at the right time. So I'm happy to go ahead with this medication. So, okay, this Ventolin inhaler, its in date is not expired. Expiry date is 2025 November. So I'm happy to use it, and it's not empty. So Harry, before I go ahead, I'll just quickly explain what we need to do. Is that all right?
Yes, nurse.
Okay, Harry, I need you to sit upright. Okay, with your chin slightly tilt.
Okay.
I need you to exhale completely. I'm going to shake the pressurized metered dose inhaler for 3 to 5 seconds to make sure the medication is well mixed. I'm removing the cap to the mouthpiece of the inhaler, and I'm checking, I'm sure it's clean and there's nothing hidden in the mouthpiece. So I've shaken for 2 to 5 minutes. I'm going to insert it right in with the spacer device, and it's this way, not this way. Note it, this way, this is the correct way to do that. I'm removing the mouth cap for the spacer device as well, and I'm careful enough not to contaminate the spacer device mouthpiece. So Harry, I will need you to exhale completely as if your lungs is completely empty. Is that okay?
Okay, nurse.
Then you will form a tight seal with your lips in the spacer device mouthpiece, and you start to breathe in slowly for 2 to 3 seconds while I depress the canister, and you make sure you are not biting the mouthpiece, for you form a tight seal with your lips. As I depress the canister, you hold your breath for 10 seconds or as long as your lung capacity can carry. I remove the spacer device, then you breathe out slowly through a pursed lips. It's the single breathing technique, and because we're using a spacer device, that's what I will advise that we go for. Is that okay with you, Harry?
Yes, nurse.
But of course, I'll just explain. We have another method, which is called the tidal breathing method or technique. You have a different covering mouthpiece, just like a mask, in the form of a mask with a spacer device as well. The same process. After forming the mask, will form a tight seal around the mouth. Depress, as I depress the canister, then you can breathe in and out into the mouthpiece of the mask. You can do that 3 to 5 times. You breathe in and out in the mask. The medication is in the mask, so you breathe in and breathe out. But we're going for the single breathing technique. Is that okay, Harry?
Yes, nurse.
Are you ready?
Yes, nurse.
Okay, you're sitting upright already. That's fantastic. Can you tilt your chin a bit for me, Harry? That's wonderful. Can you form a tight seal with your lips? Okay, without biting it. That's wonderful. Can you begin to breathe in slowly for me, Harry? I'm going to shake your inhaler for 3 to 5 seconds. Okay, I insert it. Can you form a tight seal with your lips, Harry, without biting the mouthpiece? Can you start to breathe in slowly for 2 to 3 seconds? Okay, I'm going to depress the canister. You're having 2 puffs. This is the first puff. Okay. Okay. I'm going to take away the spacer device. Can you try to hold your breath for 10 seconds or as long as your capacity can carry? Okay. 5, 6, 7, 8, 9, 10. Wonderful. Can you breathe out through a pursed lips slowly? Wonderful, Harry. So we need you to take a rest for 20 to 30 seconds because we're giving the same form of medication. But if I have to give a different kind of medication, for example, a bronchodilator and a steroid, we need to wait for 2 to 3 minutes. Okay, so 20 seconds is over. Harry, are you ready for the second puff?
Yes, nurse.
Okay, can you breathe out completely again? Okay, I've shaked your inhaler. I'm fixing it. Can you form a tight seal with your lips, Harry, without biting the mouthpiece? Can you begin to breathe in slowly for 2 to 3 seconds? Are you ready? And I'm going to depress the canister for the second puff. I'm going to remove the spacer. Can you hold your breath for 10 seconds or as long as your capacity can carry? Wonderful, Harry. 7, 8, 9, 10. 10 seconds is over. Can you breathe out slowly through a pursed lip? Okay, that's perfect. Okay, and I'm going to put this back foot. Harry, are you okay?
Yes, nurse.
Okay, and give you Just give me a few minutes. I'm going to remove my glove and discard into the clinical waste. I remove my apron and I'm discarding in the clinical waste. I'll do my hand hygiene again. I don't need to rhyme it at this time, but I make sure no step is missed. Okay, Harry, just give me a second, please, and I'll be back again in the next 30 minutes to check on you to be sure you are okay. Is that all right?
That's fine, nurse.
Okay, so I'm going to sign my name, okay, to the date today, the date of your exam. So, for example, today's date is 13th August 2022. And I'm given the medication at 10th hour. Okay, so I'm done. I'm back, Harry.
Oh, hi, nurse.
Yeah, like I said, I'm just going to give you a general advice. Your spacer device is a single use and it is for you alone. Don't share it with anyone. Make sure you clean according to manufacturer's guideline and make sure it is not damaged. Within 6 months to 12 months, 6 months to 1 year, if it is damaged or even if it is not damaged, you need to get a new one from your GP. Is that all right? From time to time, take deep breathing exercise. Follow the prescription as advised by your doctor. Avoid any form of irritants that can aggravate the asthmatic attack. Then, after using your inhaler, it is advisable to rinse your mouth with water and spit it out. This will help to reduce the side effects. Deep breathing exercise is going to be helpful as well. Is that okay, Harry?
Yes, nurse.
Do you have any question for me, Harry, before I leave you finally?
No, that will be all, nurse.
Oh, wonderful. Thank you for your time.
Thank you.
And in case you need any help, do you have your GP's number?
Yes, I do, nurse.
Okay, wonderful. And in case of any emergency, you can ring up 999. Is that okay?
Yes, nurse.
Okay, wonderful. And I'll see you again in your next appointment in 2 weeks' time. So thank you so much for your time. And that will be all. And before I leave finally, I make sure I do my hand hygiene again, following all the steps. Make sure all the 7 steps according to WHO are covered. Thank you everyone for watching. So that's all we have. Some of the things that can cause failure in this station, it's not reading your medication charts, not following your 5 rides of 7 rides of medication as it applies anyway. Then confirming it is signed, it is with the doctor's prescription, it is legible, complete, and that's it. Of course, for every skill, make sure you show some level of compassion as you relate with your patient. That's all for now. Thank you for watching. And if you find this useful, please share with friends, click like, subscribe, and see you again next time. Bye for now.